Hello, everybody. Welcome to episode 11 of the How to Become a Doctor series. If you missed our last 10 episodes, you definitely encourage you to go watch the ones that at least apply to you. A lot of our episodes here are building off the last one. So if you're wondering how to be well-rounded, what clinical experience should you be getting, that kind of thing, go back and watch this. But we had a great fall. Back in the fall, we talked about those intro episodes. In the spring, we've had a lot of exciting interviews. We interviewed an LSU grad who is an osteopathic physician. We interviewed LSU grad in podiatric medical school. We interviewed the Vanderbilt School admissions dean. So check those out. And we have exciting news. We actually started a YouTube channel. So follow us on Instagram at LSU Pre-Health. I will be posting about that channel once we get all the rest of our episodes up there. But it's a great way to spend your summer. And that kind of segues us into this topic. One great way to spend your summer is watching our episodes you missed to catch up on info about pre-meds. But without further ado, episode 11 is making the most of your summer. Today's April 27th, 2022. So you may be watching this a year from now or in a few weeks, but the idea is summer is on our mind. Some of you guys have some amazing summer opportunities lined up, and some of you guys are panicking or haven't even thought about summer, and that's okay. That's what we're here to talk about. But the biggest idea is, how do you use your summer wisely? And so what I'm going to do today is walk through year by year how to think about your summers, and then just give some ideas. So you may be, a freshman student. So you just finished your first year and you're wondering, how do I use my summer wisely? And, this really is a summer to explore. And so we encourage you guys, explore the medical field, get out there, get some clinical experience, get some research experience, go do some community service, travel, that kind of thing. So we definitely want you to get out there, go interview some physicians. And after I go through the years, I am going to talk about where to find research and clinical experience. But really want to encourage you, if it's your first year, go explore, go see the different types of specialties out there. Go get your feet wet, your hands into medicine, and start interacting with patients. But really, that sophomore year, that's when you really have a little bit more important of a summer, more critical. And if you think about it, a lot of you guys only have 2 summers before you apply to medical and dental school. And so, a lot of times people are applying to medical and dental school in June after their junior year. And so, that summer experience won't be on your application. And so your sophomore year is really when you want to spend that extra time, studying for the MCAT or the DAT or the OAT, maybe getting that deeper research experience, that deeper medical experience where you're really getting responsibility and leadership. Maybe you're doing that study abroad, possibly work in a summer camp as a leader, maybe a medical one, but, just thinking, maybe taking some extra classes to get caught up. But the idea is that freshman year, you want to explore. Sophomore year, you kind of, is your last summer for many of you who aren't doing, a gap year in between. And so we want to encourage studying for the MCAT, for the DAT, for the OAT that summer, especially. Even if you haven't taken biochem physics yet, you want to get some hours in, because soon enough the fall will fly by. You'll have winter break, and then you'll be taking your test that spring. So want to encourage that. And then, junior summer, what do you do, before we go into where you find these experiences? Your junior summer, that's the summer that a lot of you guys are going to be applying. And so, really, you may have already taken the MCAT DAT. Hopefully you already submitted your review committee application by that April or May. And now you're at the place where you're actually submitting your application. And so if you're submitting the ADSAS, you're gonna be able to submit that June 1st, usually late May for the med school app. And so you'll want to spend your time, really the first part of June, making sure you word your experiences really well, reading over your application. Once you submit, it's pretty final, aside from a few things. So work really hard on that. But also don't forget to continue your clinical experience, continue your leadership experience, because you hopefully will have an interview the next fall or spring. And you'll be starting hopefully medical dental school next summer. You want to be preparing for that. But finally, if you are a gap year student, that junior year is basically a continuation of that sophomore summer. And so that junior summer, if you're not applying that summer, you can study for the MCAT, DAT, OAT. You can go even further into your clinical and research, do that community service, get those hours logged for sure. And finally, let's say it's your summer after senior year, and once again, it's really how close you are to applying. And so, if you're not going to be applying to medical school yet, regardless, you want to think of where you're lacking, what's the lowest part of your application, and then how can you strengthen that up to be better. So that was just a quick flyover of the timeline, but I do want to talk about the topics of what I was discussing. And so the first thing I mentioned as I did that flyover of your years is the studying for the MCAT. I mentioned, basically you want to use the summer 2 years before you enter medical school will be your big study for the MCAT, study for the OAT summer, because 1 year before you'll be applying. And so, like I said, it's sophomore summer or junior summer for gap years. You want to think, how can you build this into your calendar? And so you may be working, you may be doing summer class, but if you're studying over the summer, think about, okay, can I buy some workbooks? Can I go to my local library and get some workbooks? Do I want to do some study classes or not? Up to you. Do I have some friends I can study with? But think outside the box. And so think about, okay, is there a, MCAT Adapt podcast you could listen to? What's some content review you need to do? Get some practice questions and make a goal of, hey, I'm going to do, 25 practice questions a day all summer, but take Sundays off or something, and so think about, it's a long summer. How can you use how can you use it wisely? Get some content review in, do some practice tests. That's the idea. We don't endorse a certain practice book, but we do endorse studying that summer. And so build in as much as you can, learn, enjoy it, explore, and do your best there. We also encourage, summer courses. If this is a time, any of these summers that, you can just focus on a certain course, or if you have the money and resources, you could definitely do those, but you don't have to do summer courses. They move quickly, but it could be a time where you can get caught up in a sequence if you're behind, or you can just spend some extra time focusing on a topic. So definitely an option out there. So that's my first thought, just hitting the studying. So just on that, Robbie, do you have any comments on the studying for the MCAT or classes before we move on?
No, other than, we tell you it's never too early to start, and at least to kind of get a game plan of how you're going to approach it. And, to start trying to, work in MCAT prep time into your weekly schedule, even as a sophomore. It's not too early to, Tuesdays from 2 to 4, I'm going to focus on the DAT or the MCAT, and, the Khan Academy videos. I can just watch some of those tutorials. I can just do some stuff like that. But that, that small little window of time, I'm getting my mind thinking about the test. And then obviously as it gets closer, you start putting together, more time and how you're going to approach it. But especially if, summers, when you're not necessarily as busy and, you're just hanging out at home and you're, what can I do? I mean, that's a great time to watch some of those tutorials, or just to at least start, getting some familiarity with what's going to be on the test.
Absolutely, yeah. So just, you can't start too early. Definitely note that. So that's the first big thing. The summers have different themes, but definitely want to get some studying in. Absolutely. The second thing, which is a big deal, is getting that clinical experience. You guys are busy during the semester, and so in the summer you might have some time to really log some hours, get some great exposure. And so I just encourage you. We do have that episode on gaining clinical experience, but we do encourage you to go to our Moodle page for this. I'm going to share my screen. So you can see, if you go to the clinical experience opportunities tab on the Moodle page, you can see our clinical experience examples. And so you should be able to find one of these, around wherever you're living in the summer. But, think about something as small as shadowing, just observing a physician, volunteering at a hospital or clinic, maybe volunteering for a crisis hotline, a free clinic, mission trips. There's some special trips like Atlantis where you can shadow overseas in other countries and see, what is it like to be a physician in France, but also there's some official programs, SHPEP, some programs you can apply for, but think further, thinking about working with home health, working in a nursing home, working as a scribe, going to EMT training. There's a lot of opportunities out there working with the, coroner's office. So check out this and look at where you'll be living, and definitely throw a lot of, bait out and kind of see what bites and see what sort of opportunities you can do. But the whole idea is you're going to be able to get a lot more hours logged in over a summer than otherwise. And yes, you're not going to be doing surgery or anything like that, but they don't want you to know how to be a doctor going into medical school. They want you to be exposed to medicine, exposed to patients, exposed to the challenge of medicine, and also the unique aspect of every patient, that nobody's the same. So encourage you to look at those. AED also, has some great medical experiences on their website. And so if you're looking for a job, encourage.
Matt, you're muted.
All right, can you hear me?
Yes.
Okay. Not sure what happened there, but I was just saying AED, they have some great job opportunities on their website, so check those out as well. So yeah,
And I think
study and
that
do clinical experience. But yeah, go ahead, Robbie.
sorry, I think like the summer, especially like, if it's your, you're just finishing up your freshman year or you're going, your sophomore even, and nothing worked out for you, like you couldn't find a program to get involved in, you couldn't do anything. That's a great time to maybe get your EMT and like see if there's an EMT class that you can take that summer, or your certified nursing assistant, because that's going to make you more employable in a healthcare setting if you have those trainings already. So, instead of saying, well, nothing worked out, I'm just gonna, hang out at home, check to see if there's a local EMT training class that you can finish, or even if you just go take a basic life-saving class or learn CPR, something like that, that you can probably knock out in one Saturday or something. At least that's a productive thing that you did over that time period that will also help you be more marketable when you're looking for that scribe job or those other types of things.
Absolutely, that's great. And so, like I said, we said study. That's a big focus. We say clinical experience. The third one's going to be research experience. And so you may be wondering, what research experience can I get? We definitely encourage you to talk to your LSU professors. You can get class credit in the biology major, chemistry major, physics, psychology. A lot of these you can get class credit, Kines, for doing research. So start with LSU, start with the professors. But maybe you won't be living here in Baton Rouge, and you want to move around to another place or find experience. So AAMC, they actually run, they advertise a bunch of different programs. You can see all the different programs they're advertising here. Check out their website. I can put this in the comments of our YouTube video here, but the idea is, to see all the different programs out there. There's a lot of different ones. And if you're willing to move around, you can find a lot of neat experiences, but encourage you also, like I said, look through our medical schools. This is LSU Shreveport's website, our medical school there. They have some college summer programs. You can check those out and see if that's for you. Check out MD Anderson summer experiences. They have some different ones you can check out on here. Even Our Lady of the Lake Local Hospital. This is already closed for this summer, but maybe you're watching this after the summer and you want to do this in summer 2023. They have a healthcare immersion program with different sessions, and you can see all the different immersion you get. So just encourage you to check all those opportunities out, and there's so many more. Just really encourage you, wherever you're living, there's probably a college close, and there's probably some research happening. So if you can reach out to their science department, at least if you can get your hand on any sort of research, that would look good.
I just put the wrong link in the chat.
No worries. Well, we probably won't have the chat anyways on the YouTube, but that's the idea. So any other thoughts with research mindset, Robbie?
No, I think, like people ask, where do I go to find it? And I think, you just got to be creative. You got to be persistent. And so, but definitely check if there's a specific, if you are interested in a particular medical school, that's always a good place to go. Go see if they have any summer programs. That's a way to get your foot in the door. It's a way to kind of make an impression on the people at that particular school. So, if you have ideas about where you're interested, go and check out their website and see what they have. If you just go to the website and search summer programs, they typically will have a link of anything that they have available on that campus. And that's a great way to kind of make yourself known at that school.
Great advice. Networking is a big part. Don't forget it. It's not just about the application, but also if you can have a connection to a campus, it's great. Because remember, we as we tell you guys, a medical school doesn't want to know why you're applying to medical school or why you want to be a doctor. They want to know why you want to be a doctor trained at their institution. And so as you think about that, as you interview, you don't just want to say, I want to go to a medical school. When you interview, you want to say, I'm interested in your medical school. And yes, it's great if you looked at their website, but it's even better if you've been to their campus, if you've done research on their campus, because you know what you're getting yourself into, you have familiarity, and that's going to be a big part of it as well. Another big topic I mentioned was community service. There is so much community service wherever you live. And so one big emphasis is definitely trying to do community service that involves people. So if you have the opportunity to interact with people versus, just, maybe sorting cans at a food pantry, sorting cans is not a bad thing. It would definitely look good. But if you especially have the opportunity to do community service where you're helping the underserved population and interacting with people, it's even better because, you're getting that patient or at least that people interaction. It might not be in a patient setting, but you learn how to talk to people, interact with them. And when we have some ideas, even volunteering at a hospital or hospice can get you that for sure. So think creatively, mission trips, summer camps, working, doing work with your church, with the community center, nursing homes. I mean, there are so many needs for volunteers. There's even virtual options, especially if you're in a more remote location. There's things you can do to help out. So don't look past community service. If it can be medical, great, but try to work with people if possible. Any thoughts on community service?
No, I think if you have like a hospice organization in your area, wherever your region, your town, I promise you they probably are desperately looking for volunteers. And so that's something that wherever you are, there should be some sort of an organization that's doing palliative care, hospice, that you can probably find some volunteer opportunities.
Absolutely. That's great. And so, look, we hit these big categories, right? We talked through freshman, sophomore, junior, summer. We talked through, studying, research, medical experience, service. Those are the big things. But my last part is just think outside the box. Don't forget also to have rest. Enjoy yourself. You don't always want to be stressed out. And so, as they say, sharpen the saw. You don't always have to be cutting. So how can you rest? How can you have some time to breathe a little bit? Personal growth. How can you personally develop it as a person? Maybe it's time to journal. Just journal about your experiences and document what you're learning, why you want to be a doctor, what sparks your interest. Read. We have a reading list on our Moodle page. So read a book about medicine. Read a book. It can even be fiction. But just read one that's going to help you with medicine. And definitely explore. Go visit medical school campus. Or go explore the different medical schools you're interested in. Go look at the hospitals in your area and what kind of needs there are out there. And just think creatively, traveling places, doing anything, experience, even working a regular job at a snowball stand, working hard, working with people can be a big deal. So don't minimize any opportunities. So that's the content I have for today. We are going to take questions, but the idea is whatever you're doing, do something with all your heart. Try to get good at medical experience or any experience that can help you as you are going to serve people in the future. But Robbie, any last thoughts before we move on to questions?
No, I think that we kind of talk about when the medical schools are evaluating an application or evaluating a student, it's not necessarily that they're looking for specific things. Like they're specifically looking for research, or they're specifically looking for clinical. What they're looking for is, did you take advantage? Did you, were you proactive in trying to get things done? And, what did you get out of the experience? So even if it's just traveling abroad, like Matt mentioned, sort of maybe you're going to spend the summer, just traveling wherever, that's a great life experience. And, being able to talk about that and sort of the way that it changed your outlook, or the worldview that you got, those are types of things that you can turn anything into a meaningful experience when you're reflective and you think about, the connection that you're trying to make or whatever. So don't really get focused so much on, is it clinical? Is it research? Which is better? Which is worse? It's like, whatever opportunity you have, just try to make the most of it and learn as much as you can, and then apply what you learn in your day-to-day life from that point on. So
awesome. Yeah, so what questions do we have, Robbie?
Yeah, so just a couple that are out there, like so somebody's, if somebody's gotten the opportunity, maybe they have an opportunity to do research, or they have an opportunity to work in a hospital, or work at a camp. And how do you decide which is the best opportunity? How do you choose between various opportunities if you have more than one offer?
Yeah, well, just want to encourage you, if that's you, that's a really exciting place to be.
Right.
It's stressful making decisions, but how amazing it is that you're granted multiple opportunities.
Mm-hmm.
So just be happy about that. First of all, the second thing though is, I'd say is where are you lacking in your application? So if you're doing, thousands of research hours, but you've never, talked to a patient, maybe you need some clinical hours this summer, or maybe you're working as an EMT every Saturday and you can work as an EMT, extra this summer, or you have some great clinical experience. So the simple answer is filling your application. But I think the second thing is, what do you want to do? I think passion's a big part of it. Remember, this is not a computer reading you. This is going to be people reading your essays about these experiences. So, okay, what one are you going to be more excited about journaling about? If you're asked about an interview, which one would you be passionate about? And then finally, definitely put yourself in the admissions committee's shoes, and what would you think would look better if you were trying to decide that you were a good applicant? And so, with that said, talk to your mentors, talk to your professors, that kind of thing. But you can meet with Robbie or I for advising appointment. But I think you're in a good place, and this really is a right or left decision, not right or wrong. But any more thoughts on that?
Yeah, and I mean, there's none of those opportunities are bad things. So there's nothing negative about either one of any of those opportunities, whether it's clinical, whether it's research, whether it's whatever. That's There's nothing bad about any of them. And so, but I do think it is important to kind of have breadth of experience. So as Matt sort of said, if you're already working in a research lab during the school year and you're getting that experience, and I have an opportunity to do something clinical where I get more patient contact and I don't really have much of that, then that in that case that might be the favorable one. But maybe your research is to work with the most famous scientists in that field, and so it's all circumstantial, it's all situational, but there's not going to be any negative about any decision that you make about experience. The next thing is what to do again if you're from an area where you live in the country basically, and you don't have access to large hospitals or research centers. What can you do if you're from a small town? Those kinds of things. I think we kind of touched on that with, every community's probably has some sort of social situation where there's community involvement, there's some sort of service project that goes on there, hospice, or, even if it's just, community efforts to clean up the neighborhood or just whatever. I think any place you're from is going to have something like that.
Yeah, and don't discount virtual. Obviously, in person is a great thing, but and if you have the in-person opportunity, great. But look at virtual. Also think about, okay, maybe you can't live or afford to live somewhere for a whole summer, but there might be a 1-week experience where you could go, live in Baton Rouge for a week, stay with a friend or family member, and go volunteer at the hospital for a week or do a special program. So it doesn't have to be all summer long, so try to think creatively. But yeah, there are some medical clinics and some volunteer opportunities somewhere close to you, and definitely take advantage of whatever you can.
Yeah, but a lot of people do that. Like they have family in a large city and they'll go spend 2 weeks there visiting the family, but also, shadowing at a hospital or doing something for just, a couple of weeks. So the last one is, what if you have to you need to work during the summer so that you can pay for school. So you don't really have you can't really afford to do these clinical experiences. I need a job to help me pay for school.
Yeah, we do not discount that. I was talking to a student recently that almost didn't include a really big, hardworking summer job they did every summer because they didn't think it was relevant. And absolutely, it's relevant. Any job that you're getting paid for, as long as it's legal, you want to put it on your application, because what is work? It's you usually doing something you don't want to do, which means it's hard. It's not something you do on your off day, but you have to show up on time. You need to work hard, and otherwise, you won't be working there anymore. And so, if you hold a summer job somewhere, you're going to work with people. You're going to be it's going to be marketable, as Mr. Bowen was saying. And so, if I want to encourage you guys, don't discount any experience. Don't be ashamed of it. It's important, but also once again, you don't have to hit a home run with clinical experience. If you're working 40 hours a week, waiting tables, or, working at a grocery store, whatever you're doing, maybe you can volunteer with hospice on Saturdays, or, once a week. Maybe you can do a virtual shadowing option because that's all you have time for. But just the fact that, if they ask you about it on your application, or they see you had those hours, they're not going to be wondering what you're doing with your time, because they're going to see, oh, wow, they held this job for 40 hours a week and they even fit this in.
Yeah, and work ethic is a huge thing that they look for in applications. That is a great attribute to be able to demonstrate that I have a strong work ethic and I did construction work to help pay for my school, or I wait tables until 11:30 at night, and then I get up the next day and go to school. I mean, those are things that you're demonstrating that you're willing to put in the effort and to you know not expect something to be just handed to you on that you're willing to work for what you get. And so yeah, the actual job itself isn't necessarily the important thing. It's the fact that I'm helping pay for my own school. I'm being responsible. I'm balancing my own budget and time and all that. Those are great assets to demonstrate, even if it's just working at the local diner or whatever. So
Okay, awesome. Well, any last thoughts before we close? Or any other questions?
no, I think that summers are really good opportunities. Sometimes students will say, I'm so busy during the school year, and it is a really busy time, and you never want to sacrifice your grades and all that. And maybe the only time I really can do this is during school breaks and school holidays, when I'm home. That's fine. There's nothing wrong with that. If I can't do it during the school year, that's fine. But do it when you're home, do it when you're off, between spring break, when you come home. If you don't go somewhere, you go home, look for an opportunity, try to find something to do, even if it's just volunteering at your church daycare center or something like that. Just using wise use of your time, but not stretching yourself so thin that it starts to impact all the other areas of your application.
Absolutely. Okay. Well, thanks for joining us today, or whenever you're watching this. I encourage you to use your summer wisely. And Mr. Bowen and I are working all summer, so we'll have limited appointments, due to the review committee. But if you need anything through the summer, you want to send us an email, we do have an available appointment. Definitely reach out to us. We don't take the summers off. So if you're trying to find an experience in your hometown and need help, if you're trying to decide between experiences, shoot us an email. We're happy to help you whatever time during the summer with that. So thanks for joining, and we'll see you next time.